Hello everyone and welcome to our first course panel of the day. My name is Natalia and I will be your host for this session. So we have a full programme of activities today, ranging from course and student life panels to webinars for supporting you in preparation for September. And I would like, if you'd like to attend any of our other sessions, please do follow the link that we'll share in the chat or visit our website to register for the other events. In this particular webinar, we'll hear from staff across all of our allied health courses who will introduce you to some of their highlights of their course while preparing to answer your most frequently asked questions. So there is a chat box, please do use it and do send us all your questions about the course because we're here and we're happy to help and answer any questions you may have. If you have submitted an application but you're waiting to hear the outcome, unfortunately we'll not be able to comment on any individual applications during this or any other sessions throughout the day. So I'd now like to introduce you to our esteemed panelists for this session, and I'd like for them to join me on camera. Amazing. So I'll just introduce you to Paul Joyce, who is our Paramedic Science admissions tutor. We have everyone. Yasmin Malik, who is our Therapeutic Radiography admissions tutor.
Morning.
We have Rodnik Vasalo, who is our Diagnostic Radiography admissions tutor.
Hello, good morning.
We have Sarah Wagard, who is our Physiotherapy admissions tutor.
Hello.
And we have Sarah, who is our Occupational Therapy admissions tutor as well.
Hi.
Okay, so thank you everybody. It's Jack here, and we're just going to move straight on to Sarah Wink. So if our other admissions tutors could come off camera, we'll go straight into Sarah's section.
Hello everyone, and a really warm welcome. Thank you very much for joining us today. I'm Sarah. I am a senior lecturer in occupational therapy, and I'm also the admissions tutor for occupational therapy. I've been asked to speak to you very briefly about 3 highlights of the occupational therapy program. I found it quite difficult to pick the 3, but I've decided to focus on teaching and learning, student experience, and graduate prospects. So firstly, I'm going to talk about teaching and learning. So you will be taught by lecturers who have all worked for many years in practice and in very varied and diverse areas of practice. So they're able to bring this experience from practice into teaching. You will do some interdisciplinary modules, so you'll have the opportunity to work alongside students from other programs. All of the modules have a practical component, so there's a big emphasis on learning through doing. This often happens in the Art of Living suite, which is our occupational therapy teaching room, like you can see in the picture. As you can see in the picture, it's set up with equipment like what we'd use in practice, so like the adapted bathroom equipment that you can see there, for example, or an adapted kitchen, so that you can practice the skills that you'll need for placement in a safe environment. Next, I'm going to be speaking about the student experience. At St George's, we have a smaller number of students on the occupational therapy program than most other universities. This means that the lecturers can get to know the students really well on an individual basis. There's a really personal approach, and there's a lot of opportunity for one-to-one working and small group work. And then finally, I'm going to be speaking about, I'm just going to change the slide to graduate prospects. So at St George's, we've just had our first year of occupational therapy graduates because it's a relatively new program, and they've done extremely well. Almost half of the graduates, so 46% of them, passed their degree with first-class honours, which is really excellent. We're really proud of them. The vast majority, 85% of the current graduates, had jobs at the time of their graduation. If you've looked into occupational therapy as a career, I'm sure you will know that your employability is excellent. There are loads of jobs out there for you. And really, as a newly qualified occupational therapist, you will be able to work in such a range of diverse settings, like the community, schools, hospitals, prisons, charities, private practices, just to name a few examples of the diverse range of settings where occupational therapists are working as newly qualified occupational therapists. And the Careers Office at St George's will be able to support you for up to 2 years after you graduate. I hope that gives you just a very small glimpse into some of the highlights of the occupational therapy programme at St George's, and thank you for listening.
Thank you, Sarah. Thank you for sharing those highlights. I'd now like to invite Yasmin Malik, who's the Therapeutic Radiography Admissions Tutor, to tell you a little bit more about her course.
Hi, my name's Yasmin Malik. I'm the Senior Lecturer in Therapeutic Radiography and the Course Admissions Tutor. The three key areas that I'm going to highlight today in 3 minutes is our simulation education, our student experience, and our graduate prospects. So the first highlight, simulation education. 50% of your time will be spent in clinical practice, learning and doing the job of a therapeutic radiographer. So to ease you into clinical practice, we have 2 simulation technologies here at St George's University. We've got our virtual learning environment and our treatment planning software. Our virtual learning environment is a room with a 3D radiotherapy treatment machine simulator. We also have a radiotherapy treatment couch and lasers that aid in patient setup. We have various radiotherapy equipment that you would find in a radiotherapy department. The benefit of this to you is that it creates a safe learning environment for you to practice those essential skills in radiotherapy over the 3 years and to build those confidence skills as well. Our second simulation technology is our treatment planning software system. This is where you will learn everything to do with dose distribution in the body. So you will create radiotherapy treatment plans where you will aim to provide a radiotherapy tumoricidal dose to the tumor, but at the same time minimize dose to all surrounding structures. This year, we purchased a treatment planning software system, which is entirely cloud-based. We are the only university in London to have this cloud-based radiotherapy treatment planning software. This means that over the 3 years, whether you're at home learning or whether you're at clinical practice, you can learn those essential skills in radiotherapy planning and gain those skills and experience over the 3 years. Our second key highlight is our student experience. I'm proud to say that we achieved 100% student satisfaction in the National Student Survey. We also achieved 100% student satisfaction in our teaching and learning and the support that we provide our students for all 3 of our cohorts. We also achieved our St George's University Excellence in Programme Leadership Award. Our third and final highlight is our graduate prospects. Our employability is excellent. All our students go on to qualify, graduate, and go on to become therapeutic radiographers. And our careers office here at St George's University provide up to 2 years of support to all our graduate alumni for application form. They help you with the personal statement, so that's also a good thing. That concludes my 3 minutes, but just to also highlight that if you go over to St George's University website, to our UniBuddy platform, you'll be able to speak to me about therapeutic radiography and diagnostic radiography. And we also have student ambassadors on our UniBuddy platform so that you can speak to our current students about their experience on our therapeutic radiography. Thank you.
Thank you very much, Yasmin. I'm now going to pass over to Rodnik, who is our Diagnostic Radiography Admissions Tutor. Please do keep sending those questions in.
Hello, good morning, everyone. My name is Rodnik Vassallo. I am a diagnostic radiographer and also a senior lecturer on the diagnostic program, as well as the diagnostic admissions tutor. So today we're going to talk about 3 highlights on the course. So we're going to focus on simulation education, academic and clinical expertise, and also the teaching and support. Okay, so on to our first point. At St. George's, we're very lucky to have an on-site fully functional X-ray simulation suite, which has 2 X-ray tubes that can allow 2 groups of students to practice at the same time. So we're very lucky to have that, because that's not common to find. And it also we also have DR and CR systems. We have 4 ultrasound machines, a mobile X-ray unit, a mobile C-arm, and also a PAC system. So having all these facilities and equipment on site means that students can practice in small groups prior to going to their clinical placement, so they can get used to the equipment and build up their confidence prior to going onto the clinical placement. So like Yasmin said, 50% of the time spent during the program, during the course, will be on site at your clinical placement sites. But this really good facility that we have at St. George's gives you the opportunity to practice in a safe way and gives you that confidence that you need before you're going on to outside to the real world. Okay, so on to our second point. We're also lucky to have a team of experienced academic staff that have come out recently of clinical practice or are still currently practicing within radiography, and everyone has varied backgrounds, and clinical and areas of clinical expertise, including not only the specific imaging modalities such as ultrasound, CT or MRI, but also information technology, research and management. Okay, so we can provide a broad area of core knowledge that is essential for developing yourself within the profession. This means that apart from learning the basic skills and clinical skills that you need, there is that variety that is very important within the broader aspect of the whole profession. Okay, and finally on to our last point. We pride ourselves in teaching and support, and we offer students the opportunity to have small group sessions and practical sessions, workshop sessions, evaluation sessions, and these smaller group sessions are better for students because you can feel more comfortable and create to interact amongst yourselves and learn in a smaller environment compared to the larger sessions. We also allocate personal tutors to each student for individualized support, and that tutor will stay with you throughout the whole 3 years for continuity. Okay, so you really get to know your mentor and your tutor, and he'll be able to support you throughout your development. And also finally, we also run a students career fair, which has been very successful over the last few years. We've had very good feedback about, and this we also involve several major NHS trusts. They come to our site and have a stand where you can get to meet them and talk about different areas where you could potentially be working, and this gives you a head start to be able to start thinking in your second and your third years towards that career that you are aspiring to build. Okay, so this was just, as everyone said, a very brief overview of our program, and thank you very much.
Thank you, Rodnik. I'd now like to ask Sarah to join us to tell you a little bit about physiotherapy.
Hello, good morning to everybody, and thanks for coming to our webinar. So my name is Sarah Waygood. I am a physiotherapist, a senior lecturer and lead admissions tutor for BSc Honours Physiotherapy here at St. George's. I actually first started working at St. George's Hospital in 2007 as a physiotherapist, and I've been lecturing in the university since 2009, and I became a full-time lecturer in 2014. It was really hard to choose just 3 things to highlight about our programme, but I am going to do my best and I'm going to try and keep it brief. So there they are. The first one is an applied and practical approach. Physiotherapists take a very practical problem-solving approach, and this may well be a reason why you've chosen to pursue a career in this profession. We have excellent communication skills and teamworking skills, and our learning and teaching methods at St George's really do embody this. So of course students attend lectures, and this year they might be remote lectures. And of course we expect our students to read, to watch videos, to listen to podcasts, to have group discussions, but critically, we then make sure our students have this opportunity to apply this new knowledge in practical labs, and of course in their clinical placements. So you're taking your new knowledge, the stuff that you've just learned from all of those lectures and learning opportunities, and you're putting this into practice. Students work on and with each other, and our academic years are designed so that you'll have blocks of learning at university, or perhaps this year at home, but with us kind of leading you through that, and then being able to put that knowledge into practice as you then have a block of clinical placement. So they're interspersed. Next thing is our interprofessional learning and working. Physiotherapists rarely work in isolation, and as I mentioned before, really good team working as part of a multi-professional approach with doctors, nurses, occupational therapists, radiographers, speech and language therapists, and paramedics is vital to make sure that we're able to provide best and patient-centered care. All of those professions I've just mentioned have specialised roles and will approach health from slightly different perspectives. So it's really important that we know about and understand each other's professions. And again, this is mirrored in our programme. Because St George's is a specialised healthcare university, there's the opportunity for our students to learn with and about people from a multitude of professions, and this sets our graduates up perfectly to be able to practice effectively and professionally in this multidisciplinary setting when they qualify. And finally, a diverse cohort. Our university is situated in one of the most wonderfully diverse parts of London, and our cohorts reflect this. St George's is a true community which embraces diversity. Our cohort sizes means that our students feel valued and have a really personalised experience, and I think some of my other colleagues on the other programmes have mentioned that, and the same is absolutely true for physiotherapy. There's a specialist and dedicated support for students with disabilities, and also for students who are international, and we have personal tutoring system for all students and mentoring networks for students from Black, ethnic and minority groups. Tooting was named in 2007 by the Lonely Planet as one of the top 10 coolest neighbourhoods in the world, which is something that I just think is wonderful, and St George's of course is in the heart of Tooting as a neighbourhood. It's a truly wonderful place to work and to study, and we look forward to welcoming you.
Thank you very much, Sarah. I'd now like to introduce you to Paul, who is our Paramedic Science admissions tutor.
Good morning, everyone. Welcome. My name is Paul Joyce. I'm a senior lecturer in Educational Technology and Simulation, and also the admissions tutor for the undergrad paramedic program at St George's. In common with all my other colleagues, I've been asked to highlight three aspects of our course. Very hard, because I could probably talk all day. So the three I'd like to concentrate on is our simulation centre, student support, and employability. So firstly, our state-of-the-art simulation centre. This was the first of its kind in the UK, and consists of a skills lab, where you will be taught all those individual skills you need to know as a paramedic, the simulation suite, where in the backs of 2 ambulances and 3 rooms, household rooms, a kitchen, a bathroom and a bedroom, you'll practice these skills. And then finally, we have an immersion room where you can immerse yourself in real life scenarios. The purpose of this simulation centre is for you to gain experience and confidence in your skills in a safe and controlled environment. In turn, this readies you for when you go out on the road, both on placement and when you have graduated. Secondly, we place a huge emphasis on student support. We know the course is challenging, both mentally and physically, and so have put a number of resources in place for you to access while on the course. We have a dedicated pastoral tutor who has a mobile phone that is on during office hours, and you can contact her about anything at any time. And then working with Mind, the mental health charity, we set up the very first Blue Light Champion scheme. These are volunteer third-year students who look after the well-being of all our students on the course. We've also introduced skills coaches, again, volunteer third-year students, whose role is to help you master that myriad of skills you need to know as a paramedic. We also take student feedback very seriously, and this is where the students' reps play a part. They collate the feedback from the students and present it to the program team. And where we deem it appropriate, we will make changes based on this feedback. Thirdly, employability. So what can you expect when you do our course and you graduate? Well, alongside our other colleagues and our other programs, we're in a very fortunate position that all our students find employment within months of graduating. The majority of students will go on to work with an ambulance trust, but we're finding the scope of employment now is growing. Paramedics can find themselves working in other areas of healthcare, for example, GP surgeries, A&E departments, schools, police custody suites, prisons. In fact, we had one graduate go and work on a cruise ship. I know it's been a very quick talk about these three highlights, but I hope that's given you a glimpse of what makes our paramedic program here unique at St. George's. Thank you for listening.
Thank you very much, Paul. I'd now like to kind of invite the panel to join me again on the screen. And also, before I do open up to questions, I'd like to mention that at St. George's, we've been working hard to find ways to teach our courses without disruption, whilst also keeping our staff and students safe and ensuring we follow government guidance on COVID-19. So we won't be making any significant changes to the way the courses are delivered and the content of the programs, but all undergraduate courses will have some essential face-to-face teaching throughout the first term, with the majority of teaching being online. You can read more information about those changes on our course pages under the COVID-19 updates tab. So we'll now go to questions, and the first one is, where will I be based for placement, and how often will I have placement? So if we perhaps start with Paul first.
Okay, right. In terms of paramedic placements, if you think of London as a big pie, unfortunately we have to share it with our competitors. So our part of the pie is from, say, 6 o'clock to 9 o'clock. The course is split 50-50. And so you'll be at 50% out on placement. You'll be in hospital placements in places like Croydon, Kingston, Epsom, St. George's, one more, St. Helier. And then in terms of London ambulance placements, they take place in a huge number of the ambulance stations, for example, Battersea, Brixton, Croydon, New Addington, Putney, New Malden, Richmond, and there's others that I probably haven't mentioned as well.
So yeah, if I pass that over to Yasmin now.
Our clinical placement sites are at the Royal Marsden Hospital in Sutton, Royal Marsden Hospital in Chelsea, and the Royal Surrey Hospital in Guildford, and Maidstone in Kent. Placements are basically placed, you'll be placed according to where you're living, and you can have a choice, you can have a preference. However, it is they work out where you're staying and how long it will take you to travel to the placement site. In the third year, you will have the opportunity to have electives. So if you pass all your clinical competencies, then it's possible that you can work either abroad or in a different hospital. But those are our clinical sites. They have all the specialist equipment, so you don't have to rotate through any other clinical department. You just stay in one placement site during your first and second year.
Perfect. And if I pass over to Occupational Therapy, Sarah.
Yeah, hi. So for occupational therapy, you need to do 1,000 hours of practice placement over the 3 years of the program. So in the first year, you do a 4-week placement, and then there are 8 weeks placements, 2 in the second year and 1 in the third year. And we have quite a wide variety of placements that you do over the course of the program. We need to make sure that you have experience in an acute and a community setting, and also in a physical and mental health setting over the course of the program. But like one of my colleagues has mentioned, we also take into consideration where you live, and try to place you as close as possible within the offers that we have available to where you live.
Great, and I'll now pass that over to Sarah Wagan.
Very similar for physiotherapy. As students, we try and give a very wide variety of experiences, and it might be in a hospital, it might be in a community setting, it might be in a school, but we've got so many placement providers that we work with, I couldn't even begin to list them. The kind of rule of thumb will be, though, that you will be placed somewhere that is within 2 hours of a commute from where you are living whilst you're attending university. And that might seem a really, really long time in terms of a commute, but it just means that it kind of just opens up the opportunities. And sometimes a 2-hour commute in and around London won't get you very far. So, but if you do end up in a placement where your commute's very long, then the next one, our placement team will make sure that you're much, much closer to home. There is support financially for attending placements, or you may be offered the opportunity to stay, to have accommodation at your placement, and that you can discuss with the placement team as and when that happens. And for our final year students, there is an opportunity to explore arranging your own placement, be that in the UK or indeed abroad.
Great, and finally, Roderick.
Yes, hello. So we've got as well about 10 different clinical sites that students can have their placement at. So, for example, St. George's is one of them. There's Kingston, Croydon, Guy's and St. Thomas, Chelsea and Westminster. So there's loads within London and a bit further outside of London as well. Placement will start straight away from the first year, from the second semester, and you will be spending clinical blocks of series of weeks throughout each year. So the first year, second and third year. The first 2 years, you'll be at the same placement site,
Yeah,
and then on the third. And sorry. Can you hear me?
Just lost Roderick for a second.
Can you hear me? Can you hear me? Yeah. Yeah, I was saying that for the first and the second years, first and second year, you'll be at the same placement site, and then it will be a different site on the third year. And again, you'll have a trauma site and a non-trauma site, so we get a variety of experience as well. Okay.
So the next question is, do I need to drive a car at university? And let's start with Paul and work round again.
Oh, we have this question a lot. And the simple answer is no. If you talk to any of our students on our course, first, second or third years, they'll all tell you that while you're at university, your car is just sitting outside with the petrol evaporating and paying high premiums in insurance. Halls are approximately, I think, about 10 minutes walk away from the campus, so that's easily achievable. And if you think where we are in Tooting, we have amazing transport links to all parts of London. And obviously, with the increasing number of 24-hour buses and tubes, a car is not necessary. If you're thinking about placements, all our students go to placements on public transport. And if the crews that you're with are kindly, they normally will drop you off in a nearby suitable place. So the answer to having a car would be no for me.
And over to you, Yasmin.
Exactly the same as what Paul just said. You don't need a car. There's excellent transport systems, and even on when you're on clinical placement, there's excellent transport. So no, I mean, if you're thinking of driving in, it will cost you £25 a day to park. Even parking outside the university is very expensive, so I wouldn't recommend parking. Maybe if you wanted to use a bike, cycling, that's free. I think if you drive a moped, that's free parking at the university, but I think Rodnick will confirm that because he has a moped. But I wouldn't recommend it, no.
Hi, so if we move over to Sarah from Occupational Therapy next.
Yeah, I'm going to find it hard to add to what Paul and Yasmin have said. It's the same for occupational therapy. No, you don't need a car. We do have a few students who use a car for placement. The placement team do ask whether or not you have a car, but you absolutely don't need to have a car. For some students who do have a car, and if they have a placement in, say, for example, community-based services or social care teams, they sometimes use their cars for that, but no, you don't need to have one.
Amazing. And just I guess check, Sarah or Rodnick, does it differ much for your courses?
No, very similar to what everyone else has said. Most of the students actually don't have a car, and they all manage fine. Most of the time, it's public transport. Going to the placement or coming to site, coming to the university. Yeah, like Yasmin said, if you have a bicycle or motorbike, you get free parking on site. But most of the students manage very well with public transport.
I'm just going to add, yeah, I mean, we don't, again, students don't need a car, but we do have some students who do need a car. Actually, we've got students who perhaps have disabilities, or they have another reason why they do need to drive. Perhaps they're caring and they're having to drop their kids off at school or at childminders, and then they fly into university. It is possible to park. So if you do need a car to make your university life work, then it is possible to park. There is disabled parking, there is paid for parking. There isn't financial support from the university with that. Those are costs you would have to cover yourselves, but it is doable. But don't feel like you have to go and invest in a car and all the expense that comes with in order to attend that.
Amazing. So we don't have any more questions. So I'm going to ask the panel to just say one final thing about their courses. If you do have a last minute question, now would be the time to share it. But so if I ask Yasmin to start, and if you just, I guess, tell us any last thing that you'd like to say about your course and why people should apply to it.
I would just like to say that for therapeutic radiography, going back to our NSS results, we achieved 100% in our teaching and learning support that we provide as a teaching team. So that speaks for itself, and all our cohorts are satisfied with the support that we provide. So and you'll be training in the best clinical placement sites. Royal Marsden Hospital is well renowned for research and the most up-to-date technology and clinical trials, as is the Royal Surrey Hospital. And we're the only university in London with a cloud-based treatment planning software system. No one else has this in London. So I think those are our unique benefits.
Perfect, thank you. And on to Sarah from Physiotherapy.
I mean, I don't want to repeat myself. Being a physiotherapist is the most wonderful profession. I'm going to say that. I'm biased, I'm a physio. Learning and working at St George's is fantastic, whichever profession you choose. And as I said earlier, I am repeating myself, we'd love to welcome you at St George's. And whether or not you come, in the meantime, immerse yourself in everything that's going on in the media and in social media, in health, and really start to embrace your career in a health profession.
Amazing, thank you. And what would you like to share about why students should apply for your course, Occupational Therapy, Sarah?
Yeah, Yeah, I also don't want to repeat anything I've said, but yeah, please come. We'd love to welcome you onto the program. Occupational therapy, again, I'm biased, but I really think occupational therapy it's often a profession that's not known about as well as some of the other health professions, but it really is such a rewarding career to work in. And what I really like about it is just how diverse it is, what diversity of settings you can work in, and such diversity of people that you can work with, from people in prisons to refugees to people in hospitals to preterm babies to the elderly. Yeah, we really hope that you will join us on the program.
Amazing. And I'm now going to ask Paul to share his final thoughts on his course. Paul, are you with us? Sorry, I'll pass over to Rodney perhaps now, then we'll come back to Paul.
Yes, so as regards diagnostic radiography, obviously we all love our professions, but with diagnostic radiography, if you're looking for something which you want to work with the latest technology and you want to learn about the human body and the anatomy and the science and the physics, then obviously that's the course for you. I love the variety that exists within the course, that you're able to have the potential to work in different areas and with different people within the allied health profession. And as regards St. George's, well, we're very lucky to be within a major NHS trust, and yeah, I think really it's a really good opportunity for anyone looking to coming into this profession.
Amazing, perfect, thank you. And now hopefully we can pass over to Paul.
Yep, sorry about that glitch. 3 extra things to say about Paramedic Science at St. George's. We're proud to say we are the biggest paramedic course in the country. Also, the number of staff that we have, I would say 96% of them are practicing paramedics. So you're not just getting taught by fuddy-duddy old lecturers, you're getting taught by paramedics who go out and are on the job. And last but not least, think of where you do your placements. You're doing them in London, one of the biggest cosmopolitan capital cities in the country, in the world, I should say. So the amount of experience you'll get on placement in London is immeasurable. So think about that when you're thinking about applying to do paramedic science anywhere in the country. And I wish you all the best with whatever you choose to do.
Amazing. Thank you so much to all of our panelists for sharing insights into their course and for answering your questions. I'd just like to reiterate that you can talk to some of our course team members and some course students as well on UniBuddy. You can find out more about our courses on our course pages on our website. And you can also join the other sessions throughout the day. So we've got a really amazing program of sessions, so please do sign up to those. And you can also put in an application to lots of our courses today if you haven't done so already, but if you have done so and you've got your offer, congratulations. We look forward to seeing you in September, and thank you for joining us for this session. Thank you.